In today's Eye on Health, now that COVID vaccines are more readily available, the push is on to make sure everyone gets a shot.
And we've heard about this. There are some pockets of our population that have been harder to reach. So here with a look at who that is and how to get the vaccines to them is Richard Clark, the Chief Analytics Officer at Highmark Health. And we're so happy that you're joining us here today to talk about this, because this is something that maybe many of us aren't thinking about, but you are.
Yes, absolutely. And, thank you so much for having me this morning and allowing me to speak to you all. So the, vaccine distribution has been something that we've been clearly working very hard at here, both at Highmark Health and across Allegheny Health Network, and really, signifies a lot of hope for us, hope to, get back to normal. And, there have been two dimensions to that for us, really. One is, of course, the rapid deployment of the vaccine, and through our Allegheny Health Network, we've done roughly 300,000 vaccinations to date. And but also not just the rapid deployment, but the equitable distribution of that.
Talk to us about a little bit about how you try to accomplish that, because it has to do with looking at data and using technology, right?
Yes, it absolutely does. As the Chief Analytics Officer here, I'm accountable for all of our work around data and analytics, and I have to say that throughout COVID, it has been a prime part of our strategy. And one of the ways that we're doing that is we're using data to both define where we have events. So we have a variety of events, vaccination events that we have, some mass vaccination events, and then some smaller events kind of in different, they're at our own facilities or even going into the communities at time. And so we're looking at data to inform where we have those events. And then once we have them, especially the mass vaccination events, we're using data to inform different outreach strategies.
And Richard, talking about getting into different communities, you guys actually have a van, and I hope I'm saying this right. It has a name, Kate, right? So tell us about the van and how you use that as a tool.
Yes, that's exactly right. That is the name, Kate, and that's in partnership with the Latino Connection. We're actually going on tour with the vaccine. And it's the same van that we used at the beginning of the pandemic for our COVID-19 testing, bringing testing into the local communities. We're doing the same with vaccinations. And folks today can go online and see the tour and sign up so that when the van is near them, they have easy access to a vaccine. And making sure that we're building confidence and that we're providing access is critically important to us as we drive towards that kind of herd immunity levels that we need to really get back to normal. It's very important to us that access does not become an issue here. So we're doing everything we can to build confidence, provide access, to make sure that we can get as many people vaccinated as possible to reach that kind of herd immunity level required for us to really start to get back to normal.
Yeah, well, you know what, without doubt, there is a lot of work going on behind the scenes, and we know that you're part of that effort too. So thanks to you, Richard Clark, Chief Analytics Officer with Highmark Health.
Thank you so much.
All right, and we also want to thank Highmark Blue Cross Blue Shield, together with Allegheny Health Network, for sponsoring Eye on Health Wednesdays right here on PTL.